Bonjour, madame, bonjour, monsieur. Soyez donc les bienvenus à ce webinaire à l'initiative de l'Alliance pour le contrôle du tabac en Afrique. Je suis Germain Doubidi, directeur de publication de la presse en ligne Interface Presse et du bimensuel Jeunesse Info ici au Togo. J'ai l'immense privilège de modérer ce webinaire sur les thèmes cigarettes et réduction de risques, point de vue de l'Afrique subsaharienne. Et c'est donc, comme vous l'aurez constaté, à l'occasion de la Journée mondiale de la jeunesse. Ce webinaire est disponible en français et en anglais. Et vous pouvez cliquer donc sur l'icône de l'interprétation et vous serez servi selon votre choix. Je voudrais informer nos chers participants que les questions seront reçues dans le chat et seront remontées au moment voulu aux panélistes. Et je disais tantôt que c'est un panel de haut niveau, qui va donc animer le webinaire. Vous comprendrez pourquoi tout à l'heure, mais je voudrais d'entrée de jeu dire que c'est le panel de haut niveau est composé du professeur Lekan AYO-YUSSUF, de Docteur Catherine O EGBE et de AYO-YUSSUF. Et les deux experts, Lekan AYO-YUSSUF et Docteur EGBE, ont publié justement un rapport sur les thèmes du webinaire, justement l'Afrique, cigarettes électroniques et réduction de risques, point de vue de l'Afrique subsaharienne. Donc, les deux experts nous présenteront succinctement ces rapports et nos chers participants auront quand même à poser des questions. Et donc, sans transition, nous allons donner la parole aux chers panélistes pour leur présentation succincte. Et, professeur Lekan, bonjour.
Good afternoon.
Bonjour, professeur. Oui, merci. Vous êtes l'un des experts de ce panel de haut niveau qui va animer le webinaire. Vous avez la parole pour votre présentation succincte.
I thought Prof. Catherine would start, but I'm happy to start.
I think I should start, Prof.
Okay, maybe you should start so that to make this.
Non, mais nous demandons, en tout cas, nous demandons au professeur Lekan juste sa présentation succincte avant d'aller en détail dans le rapport. Tout juste une présentation de civilité.
Thank you. Thank you. I'm Professor Lekan AYO-YUSSUF. I'm the director for the Africa Center for Tobacco Industry Monitoring and Policy Research at the University of Pretoria. Thank you very much.
I am Dr. Catherine
pour cette présentation succincte, professeur Lekan. Et nous tournons donc vers Docteur Catherine O EGBE pour sa présentation. Donc.
Okay, I am Catherine O EGBE. I work at the South African Medical Research Council as a senior specialist scientist. Sorry for the noise.
Merci beaucoup, docteur, pour cette présentation. Kevin devait se présenter également, mais je pense qu'elle n'est pas encore en ligne. Nous allons donc, docteur Catherine O EGBE, vous retourner à vous pour vous donner la parole pour que vous puissiez nous présenter, en tout cas nous résumer le rapport. Et donc, vous avez la parole. En tout cas, vous avez
I will share my
15
screen,
minutes
just
pour
a
la
minute.
présentation et quelques questions. Oui.
Can you see my screen? Can you see my screen?
Yes.
Okay. Just 1 minute to hide this. Okay. So so this publication, it's not a report. I just need to make that correction. We wrote it as a kind of a review of the literature, but we also only published it as an editorial in Tobacco Control, one of the foremost journals, or if not the foremost journal in tobacco control globally. And so it was published in July as the editorial for Tobacco Control for the July edition. My slide is not moving. Okay. So just to lay the foundation or the ground for the presentation, we know that global tobacco prevalence, tobacco smoking prevalence is around 17% right now, but in Sub-Saharan Africa, it's about 10%. And the WHO has reported that there's been a decline in tobacco use prevalence around the world. And in many countries in Sub-Saharan Africa, that prevalence is really below 10%, sometimes just hovering around 10. We have some countries which are outliers, like South Africa, which is around 20-something%. But we know that there is a gap in tobacco control in the region because smoking cessation services are not widely available. The ones that are available are not easily accessible to the people, accessible to the people who need it. And so this gap is being exploited by the tobacco industry by marketing the newer products like the e-cigarettes and heated tobacco products as harm reduction tools. So the first thing we need to understand is what is even harm reduction? Where does it come from? We know that harm reduction is being used in the illicit drug treatment or drug control as a drug control strategy. It's seen as one of the strategies to control drugs. So it's not like it's a standalone policy or a policy that is the only policy that is being used to control drug use in the world. So the institution or the organization called the Harm Reduction International defined harm reduction as the policies, programs, and practices that aim to minimize the negative health, the negative social, and the negative legal impacts of drug use. And so they also say that it's grounded in social justice because it seeks to bring about positive change. It seeks to work with people who are using drugs without judging them, without forcing them, or without discriminating against them, or without making sure or putting a precondition for helping them as you know, needing for them to abstain from using the drugs that they are using. So this harm reduction is actually trying to balance between the moral or moralistic way of looking at drug use, where people who use drugs are seen as being weak, as being unable to control themselves, as having made the wrong choices in life, against a medical model where these people are seen as people who are suffering from an addiction and need treatment. So there are some criticisms of drug harm reduction around the world. So it's not a policy that everyone in the field has accepted, but there are some people who believe that, no, it's not really supposed to be because it's kind of endorsing drug use, or it's making government not to be able to do the work or shying away from doing the work of controlling drug use as they ought to be. So there are other criticisms that I've outlined here, but for lack of time, I wouldn't go through all of them. So what about the tobacco harm reduction debate? It's typically a debate that has been, waxing stronger and stronger every day, especially in high-income countries. But the discussions have always been around the context of the policies and the situations, the realities in high-income countries. So we were thinking that, okay, if we want to bring this discussion back home to Sub-Saharan Africa, would it even fit? And so we found out that, okay, by looking at the definition of harm reduction and what it seeks to achieve, the scenario in Sub-Saharan Africa is kind of unique. The context also is very unique. So even if e-cigarettes, for example, is beneficial to public health in some high-income countries, what we found was that based on our just reviewing the literature is that following the principles of harm reduction, the definition of harm reduction, that may not fit in. And so that was what gave birth to this paper. So I also looked at, just for also for the sake of this presentation, I looked at what the tobacco industry defines as harm reduction. And I was very surprised to see that on the Philip Morris International website, they said harm reduction is not equivalent to or even better than stopping the original behavior, which goes against what, trying to reduce the negative health effects of the product. Because at the end of the day, if you are trying to reduce the negative health effects of the product, then you have to seek, something better than using the product. So if they are saying it's not equivalent to stopping the original behavior, it's not better than stopping the original behavior, that is kind of problematic. But I think that they are trying to couch it in a way that will make them continue to sell their cigarettes, because of course we know cigarettes is the culprit here. So I also looked at the Tobacco Tactics website, which is one of our public health websites that you can find very good information being run by STOP at Bath University of Bath. And they said it's the concept of harm reduction refers to reducing the levels of disease and death that is caused by tobacco use. And then when you look at the WHO FCTC, the Framework Convention on Tobacco Control, the definition of tobacco control itself includes the word harm reduction. And if you look at all the policies that are supposed to stem from the FCTC, they're all geared towards reducing the harms caused by tobacco to the population, not just to smokers, but to those who are exposed to tobacco smoke and those who may even be family members of these people who smoke or farm tobacco. And so we drew out 5 questions from the definition of harm reduction as defined by the Harm Reduction International. I won't read these questions because you'll see them shortly. So the first question is, do e-cigarettes aim to minimize the negative health, social, and legal impacts of tobacco? So when we are comparing the harms caused by cigarettes and e-cigarettes, do they reduce the harm? So some risk assessment experts, they believe that it's not even feasible to compare these two products because they are two different products. They differ in so many ways that it becomes problematic to say this is better than this. And so you hear some people say, we don't even want to go into that discussion because these products are essentially different products. We also know that many studies have shown that there are lower amounts of some toxins in e-cigarettes aerosols compared with cigarette smoke. But we also as well know that there are some toxic components of e-cigarettes that are not present in cigarettes because, of course, the product itself is different. It uses some metallic components which you won't find in your traditional cigarettes. So another fundamental thing that we need to remember when considering the harms caused by these products is the fact that for some tobacco-related diseases, whether you smoke 1 stick of cigarette or whether you smoke 20 sticks of cigarette, it doesn't matter, you'll get the disease anyway. For cardiovascular diseases, for example. So those diseases where the dose response doesn't follow, whether you are having less toxins, less amount of toxins from e-cigarette or not, doesn't count because you will still have the disease. And so we say less exposure doesn't always mean less harm. For the social and legal impact of e-cigarettes, we know that there is no evidence that is showing that e-cigarette has contributed to reducing the social acceptance of cigarette smoking. In fact, we know that with the introduction of e-cigarettes, some people who wouldn't have smoked before have ended up transitioning to smoking traditional cigarettes after trying e-cigarettes, which we call the gateway effect. We know that e-cigarette is not reducing the social acceptance of cigarette. Instead, it's even increasing it. We also know that the industry uses e-cigarette to circumvent some legislations on cigarettes. For example, we've heard of where the industry advertises e-cigarette as saying, okay, cigarettes was banned from inside public places like bars and restaurants. Now you can bring e-cigarettes back. You can bring cigarettes back through e-cigarettes. So these things are actually going against the rolling back the achievements that we've made on tobacco control globally. So for the health risk of e-cigarette, we know that the field is evolving, first of all, but there are tons of studies that have been done showing the health impact of e-cigarette. And so it's not deniable. You can't deny that e-cigarettes also cause diseases. For the second question, the question we asked is whether the provision of e-cigarettes or the access to e-cigarettes align with justice and human rights. Of course, we know that e-cigarettes are more expensive than traditional cigarettes, especially in Sub-Saharan Africa, where the cigarette taxes are low, the prices of cigarettes are very cheap, very, very cheap. And so the e-cigarettes, of course, are more expensive than cigarettes, especially in our context. The second thing is, are those who smoke being told the truth about the health impacts of e-cigarettes? So if we want to follow the social justice and human rights angle to it, if you deprive the users of these products of the information that will help them make informed choices, then you are not respecting their human rights. You are not being just. The third question is, are e-cigarettes targeted at and available to those who use tobacco products currently? We know there are tons of studies that have been carried out showing that e-cigarettes is not just being marketed to those who currently smoke. In fact, the way they are designed, they are more child-friendly than even cigarettes. They are made in a way that young children are attracted to them. And because of that, it becomes problematic for us to say, is this product targeted at helping people reduce harm? Is it targeted at those who don't want to, who want to stop, who don't want to continue smoking cigarettes? Because we know that many children who otherwise would not have smoked are currently using e-cigarettes, and some of them have transitioned from e-cigarettes to traditional cigarettes. So e-cigarettes also, some e-cigarettes are now being made with what is called nicotine salt, which makes it easier for people to get higher quantities of nicotine. Nicotine, of course, is the addictive substance that is in tobacco and these products. And so when a product that is supposed to be reducing harm is made to increase addiction to that product, it goes against the concept or even the policy of harm reduction. The fourth question is the emphasis of the promotion of e-cigarette on supporting positive change? We know that the industry promotes e-cigarette using two conflicting narratives. They use the one that suits them, depending on the country, depending on the time. So sometimes they say these products are cessationist, so they're supposed to help those who are smoking stop smoking. And then they go again to say, no, these products are supposed to reduce harm for those who want to continue to smoke, to continue to use these products. So as cessation aids, we've done studies in South Africa here where we use over 18,000 participants, and we found that instead of e-cigarette to help people quit, it's actually reducing the likelihood of quitting. And it's also encouraging, it's also linked to a greater likelihood of the people who use them to relapse. That is, they tend to go back to using their cigarettes if they are trying to use e-cigarette to quit. And there have been studies also showing that, people who use e-cigarette to want to quit, they are 28% less likely to quit smoking. Another thing that we found in our study was that those who are saying they are using e-cigarette to quit, they are even trying other means. So they are using all of them together. They're using pharmacotherapy, they're using counseling. At the end of the day, you can't really say that those who have even said that they quit with e-cigarette, whether it was just that e-cigarette that made them to quit. And this is not to say, disclaimer, this is not to say that one or two persons may not have used e-cigarette to quit successfully, but at population level, that has not been found to be true. So another issue the industry mentions is that when they want to speak on harm reduction, because I just finished talking about cessation, now they go to harm reduction. They say the reason why they promote e-cigarette for harm reduction is because as smoking prevalence reduces, there will remain some people who they call hardcore smokers, those who don't want to quit or are who are unable to quit or are not just wanting to quit. Those are called the hardcore smokers. But what studies have found around the world, this is not even in one country or one region, Europe, America, what studies have found is that there's nothing like hardcore smokers. What we find is that when the smoking prevalence is reducing, the remaining smokers are also cutting down on their cigarette smoke per day. They are trying to reduce the harm as much as possible when they cannot quit or they don't want to quit. So the smoking population is not hardening, it's actually softening, which makes it not a basis to support e-cigarette as harm reduction. So the last question there was that, is abstinence from nicotine products required to use e-cigarette? Because remember the definition said it wasn't a condition. It is not a precondition for someone who is using drug to be introduced harm reduction products.
La présentation est très intéressante, mais si vous permettez, nous allons à la fin, permettez une minute. Nous allons presque à la fin.
I'm trying to round up now. So what we found was that, yes, if you want to look at this cigarette as, you don't need to end using cigarettes, then it becomes okay. But the problem now is that studies have shown that dual use of cigarettes and e-cigarettes is more harmful than using either of these products alone. So the three contexts where drug harm reduction succeeds is when you can mitigate the initiation of drug use, which we know is a problem because young children are using e-cigarettes, when you can account for compensatory behavior, that's people taking more than they should just to compensate, and when you can you can have that strategy as part of a combination. So the question is, can you trust the industry to lead the way in curbing the tobacco epidemic when especially they are continuing to aggressively market cigarettes? I don't think so. Based on their history, we cannot. And that's why the FCTC advises that we should protect our tobacco control policies from the vested interest of the tobacco industry. So this is just a summary of what I just said. You can see this picture here. This is e-cigarette, this is a cartoon. Tell me if this is not promoting the product to be used by kids. I'll stop it here. Thank you very much.
Docteur Catherine, pour cette brillante présentation successivement sur la question. Vous nous avez fait comprendre qu'en fait, que ce n'est pas un rapport, que c'est une revue de la littérature sur la question, mais vous êtes allé quand même dans tous les aspects de la dimension, la question de la réduction du risque et tout. Nous devons poser certaines questions, mais nous allons plutôt nous préférons plutôt donner la parole à Docteur Lekan pour sa présentation et on revient justement pour les questions aux panélistes. Et donc, Docteur Lekan, vous avez Youssou, vous avez la parole.
Thank you very much. I hope you can see my slides. So, Dr. Catherine has provided...
nous voyons nous le voyons justement.
Okay, thank you. Dr. Catherine has provided you with a framework for harm reduction. I'm basically going to try to provide some data in support of why we feel harm reduction may be problematic in the Sub-Saharan African region. As you probably have heard, e-cigarettes in particular has been promoted as a harm reduction product or reduced risk product, as they have been done in developed world. And we thought it was important to examine this against the situation because context matters a lot. Dr. Catherine already provided this framework as well. I think what is important to note here, in terms of harm reduction for drug control, it requires a target of individuals who use drugs, not anybody who does not use drugs. Secondly, it should result in reduction in harm. caused by the drug itself. In Africa, we are a lot of countries with average smoking prevalence less than 10%. And many of those countries have experienced a reduction over the last 20 years since FCTC. Most countries around the world that are promoting harm reduction do have smoking prevalence higher than that. And they want to target smoking prevalence to go down to under 10%, about 5%. But about half of the countries, or at least 40% countries in the African region, as you see from here, already have smoking prevalence at below 8% for a majority of countries, most of them being just under 6%. So we already at the stage where many of these developing countries or the developed countries want to be by using harm reduction. So we don't need harm reduction to get to where they want to get to. What is going to happen in Africa? We know harm reduction has been promoted by the tobacco industry for a very long time. In fact, during the World Conference of 1964 and 1967, there were discussion of harm reduction already. At that stage, it was using light cigarettes. We now know light cigarette does not reduce harm. There was also then in the 80s talk of Swedish snus, up to even the 90s, because I remember going to one of the World Conference, I think it was 2003. It was a big issue. And of course, now we have this product or reduced risk, reduced exposure, potential reduced exposure products, or then more recently, hence. All of this is dependent on youth response. So it is important that we're talking about youth today, and I'm going to focus a little bit about that. The impact of harm reduction, be it drugs, be it tobacco, is dependent on youth response. If youth respond, then you reduce total use. So what has happened? In Africa, there's a large increase in number of youth compared to anywhere else in the world. You can see the graph. The brown graph is Sub-Saharan Africa. So the industry sees Sub-Saharan Africa as the place to sell its product. It's a place to sell its product, and majority of its product is tobacco, not e-cigarette. And this is one of the considerations where we are talking about harm reduction. One, we do not have the situation as yet that require us to move away from prevention. And prevention means targeting the youth not to take up the habit of tobacco use or even take up the nicotine use. Just to remind us, the things that make youth use tobacco, and I've just added vape because it's the same, exposure to ads, you're resonating themes because youth are very impressionable. So when they hear hashtags, they're easy to get impressed. Low price, ease of access, youth appealing flavors like strawberries, health claims that it does not harm you, ease of product, and of course, when they see these things in movies. What are we seeing in Sub-Saharan Africa and in South Africa that has banned public billboards? You see vaping being advertised, even TV screens until it was stopped. We also see e-cigarettes now being sponsoring concerts. You can see there is Boost, which is e-cigarettes, sponsoring the concert, but that lady is carrying cigarettes. Those young youth, they're actually selling cigarettes right in front of the kiosk of e-cigarettes. So we know the marketing is targeting young people. That's why e-cigarette or harm reduction with e-cigarette is problematic. Even during COVID, they had internet live stream to launch the Boost with all these strawberry colors. Therefore, it is very clear that e-cigarette is targeting youth. This is not targeted at adult smokers who are likely to reduce their health risk. We also have seen from South Africa, where we had most data, that cigarette smoking is going up, e-cigarette is going up. they are not switching to e-cigarette. They continue to smoke, and they're also using e-cigarette. And Dr. Catherine said earlier on, dual use of these two is even worse than using only one of this product. So from all of this, it is clear that tobacco control law needs to be strengthened. You need a strong base of tobacco control to protect the youth. If e-cigarette were to work anywhere, you have to protect the youth from taking up e-cigarette if it were to work as a harm reduction. Because in Sub-Saharan African countries, the tobacco control laws are not strong, but they're also not often implemented. And we know tobacco industry is also there to interfere with those laws. They've already said this e-cigarettes and reduced risk is for continued effort to support normalization. They want normalization of industry. It's not harm reduction of tobacco use. It's normalization of tobacco industry. And this is what we need to make sure that we do not fall into that situation. As I said, the resource constraints has meant that competing priorities for many of the Sub-Saharan African countries, and many of those laws are not implemented, and therefore their ability to protect children and young adults from initiating cigarettes is much lower than in these more developed countries that are promoting e-cigarette for harm reduction. So to end my presentation and summarize, in order to test whether e-cigarette can work for harm reduction, we've used this case study in South Africa and many of the data that I've presented to you. The assumption that e-cigarette can work for harm reduction is that, one, smokers are aware and are concerned about their health risk and will be willing to switch completely to this supposedly reduced risk e-cigarette. We now know that they are using both together. Those who are smoking are also using e-cigarette, and the youth who are not smoking are using e-cigarette. So it's not a matter of switching. So that assumption is incorrect. Second is that there's a large percentage of inveterate or hardened smokers who are unwilling and unable to quit. Dr. Catherine has already provided that that is not true. In fact, in South Africa, we estimate that just about 6% of the so-called hardened smokers, and many of them are willing to quit for health reasons. And therefore, this assumption is also not completely correct. The next is that those who attempt to quit using e-cigarette will be successful. We've already done studies that have shown that they actually are more likely to relapse if you use e-cigarette for your cessation, at least with data from a large population study in South Africa. And finally, the assumption also is that if you use e-cigarette from harm reduction, there should be minimum unintended consequences at the population level, particularly youth initiation, and that it shouldn't influence tobacco industry interference. We also now know that is also not true. Youth initiation is promoted and it's actually a target for tobacco industry, and tobacco industry is using this to interfere with tobacco control laws in Sub-Saharan Africa. So in conclusion, what must we do? We should invest in cessation services to help those who want to quit, not using e-cigarette, but their cessation medication that are approved. If e-cigarette wants to take this product to the medicines councils in different countries, they must go and approve them just the way nicotine replacement therapy or NRTs are approved. Secondly, we have to regulate e-cigarette to protect young people from being targeted by the industry. We also need to disallow the use of unfounded health claims because, as I said earlier on, that could influence young people. And lastly, we need to continue to update ourselves, making sure that there's research on e-cigarette use in the region. And I thank you very much, and I'd like to acknowledge our co-authors, Mrs. Ashima Khan and Dr. Andrew Sheheb from the University of Pretoria on this paper. I'm happy to take questions. Thank you.
Merci infiniment, Docteur Lekan, pour cette présentation. En tout cas, je retiens en un seul mot que quand même la question de risque, de réduction de risque telle que, en tout cas, telle que pensée par les firmes ou telle que présentée aujourd'hui n'est pas adaptée à l'Afrique subsaharienne. Nous avons compris de long en large par rapport à votre présentation. Nous allons vous poser tout à l'heure des questions, mais si vous permettez, nous retournons à Docteur Egbe, Catherine Egbe, pour poser des questions par rapport à sa présentation et on vous revient tout à l'heure, Docteur Lekan. Merci beaucoup. Docteur Catherine Egbe, tout à l'heure dans votre discussion dans l'article, nous avons, en tout cas dans la discussion de l'article justement, nous avons lu que les principes de réduction des risques tels que définis par la Convention cadre de l'OMS pour la lutte anti-tabac sont appliqués ou mal appliqués dans le contexte de l'utilisation des cigarettes électroniques. Est-ce que vous pouvez nous expliquer davantage cette problématique?
Thank you very much. What I mentioned was that the FCTC itself is aimed at reducing tobacco harm. If the FCTC is implemented effectively, most of the things that we're trying to achieve by, or most of the things that the industry claims they will achieve if people use e-cigarettes, the people will achieve them using, the people will achieve them by an effective implementation of the FCTC in their countries. So the FCTC itself is comprising of supply and demand reduction strategies. And if these are implemented, young people will be protected from initiating tobacco use. People who don't smoke will be protected from tobacco smoke, as well as the smokers themselves. They will be encouraged to reduce or even quit, because, for example, the health warning labels are expected to encourage those who are smoking to stop. So there are so many strategies that are embedded in the FCTC. If they are implemented, they would take care of whatever harm that the tobacco is causing. And I think that's the position that we took in the paper. Thank you.
Un instant. Oui, merci beaucoup. Merci, Docteur Catherine, merci beaucoup. Mais vous permettez, nous voulons vous poser encore une question. Et quels sont donc les principaux dangers des cigarettes électroniques par rapport à ceux des cigarettes traditionnelles?
Okay, so part of my I didn't have time to go through it in my presentation, but what we've seen in the literature is that, okay, so let's go back to the fact that nicotine is present in both products. Nicotine is the addictive product, so that's what keeps people smoking or keeps people using the products, and that's what make it difficult for people to also quit. Sometimes you hear people say nicotine is harmless, but we know that nicotine is not harmless. It has some impact on the body. It increases the blood pressure. It can cause DNA damage and so on. But we also have flavorings in these e-cigarettes. They too, when they undergo combustion, they cause harm to the body on another hand. And then we have some other components that you find in cigarettes that are there in e-cigarettes as well. And these components also cause the same harm. Like I mentioned in my presentation, some of these components, some of the toxins produced by e-cigarettes, they've been found to be less in quantity compared to cigarettes. But being exposed to a lesser amount does not always mean that you are going to be less likely to get to contract the tobacco-related disease that component causes. And so that is why we say that less exposure does not always mean less harm. So e-cigarette has been found to increase asthma, so it generally impacts the cardiovascular system. And of course, we've heard of lung cancer recently, the recent publication. We've heard of the fact that it affects the development of the development of the brain, because when young people use nicotine, their brains are still developing, and we know that nicotine impacts on the development of the brain. So there are so many, of course, like I said, the field is evolving. The information that we get every day concerning the harms caused by e-cigarette is evolving, because these products have only been introduced in the last 2 decades. And so as we continue to monitor the space, let us also be open to see or to read more about the different findings that are coming up as we progress. I hope I answered your question.
Oui, bien évidemment, vous avez répondu à nos questions, mais nous n'allons pas vous lâcher de sitôt. Et donc, nous voulons encore demander, en tout cas, quels sont les aspects les plus importants à prendre en compte lors de la formulation des recommandations pour les utilisateurs de cigarettes électroniques? Je pourrais reformuler. En tout cas, je demandais quels sont les aspects les plus importants à prendre en compte lors de la formulation des recommandations pour les utilisateurs de cigarettes électroniques.
Is that question not for Prof or me? Is it still for me? Oh, I thought you said you're leaving me now. So can you please come again?
No.
Okay, I thought you said you were leaving me. So
okay,
I said...
okay. Je reprends pour vous avec beaucoup de plaisir, Docteur Catherine. Nous avons plaisir à vous écouter. Donc, nous voulons encore vous poser une question. Souffrez donc que nous vous posons encore une question. Et donc, je demandais quels sont les aspects les plus importants à prendre en compte lors de la formulation des recommandations pour les utilisateurs de cigarettes électroniques.
So, I get your question now. So, I think that e-cigarette users must first of all be told of the harmful effect of using these products. Whatever information is out there, because I think that that's one of the places where tobacco use was really a problem, because many years passed before people who use the products were informed about the harms caused by the product. So the industry knew some of these harms, they hid them until some scientists started suspecting. And even when the information was made public that, okay, these products will be the ones causing the lung cancer that we are seeing escalating in the world, the industry denied it. So I think that learning from the tobacco industry, we should, as much as possible, inform the people who use these products of the harms caused by these products. No matter how effective it may be for them individually, they must be allowed to make the informed choice to say, okay, I know this product can cause me this harm, and I'm deciding to use it. On the part of the government, I think that the government needs to regulate these products as soon as possible. What you find is that the industry is allowed to sell these products to people, and afterwards they start regulating. But this is an addictive product. So when you allow it to be sold to people, then you get them addicted. Then how do you want to use the law to bring them back from their addiction? So I think governments need to be proactive. And unless the products are regulated, my recommendation would be, do not allow them to be marketed in the country unless there is a law that can regulate these products. Otherwise, you are putting the lives of the people after profit. You are putting profit ahead of the lives of the people. I think I'll stop there.
Merci, merci, docteur. Et maintenant, en tout cas, pour terminer sur ce volet, nous remarquons qu'en tout cas, les contextes des nations de nos pays ne sont pas les mêmes. Et comment donc ces recommandations peuvent être adaptées aux différents contextes locaux.
Yes, I'm still online. So I think that even though our countries are different, in Africa, we tend to be having similar problems in terms of our regulations. Our regulations are weak because we have the industry, which is so powerful, and they have access to the politicians. They can influence the policy to suit them. And so we tend to have, at the high level, similar problems: weak laws, lack of implementation, young population. That is peculiar to the whole of Africa. We have very young population. And so I think that we could, as a continent, come up with a policy. I often say that I believe that the African Union needs to play a part. If you go to the European Union, they have a policy that all the countries in the European Union is trying to like they use to inform their policies in their different countries. We could, for me, I feel that that's an easier route for regulating these products, where the regional body has a position. Hopefully the regional body is not influenced by the industry to do to make laws that are more that are more pro-industry. If they are not, then each country can then be thinking of domesticating such positions. For me, I feel that in Africa, we need to be more proactive, and we need to make sure that we're tackling these products very well. But I also hear Professor AYO-YUSSUF say often that the e-cigarette issue is used as a distraction in Africa, because if you look at the population of those, or the prevalence of e-cigarette use in the continent is very low, but then there's a lot of noise made by the industry to distract policymakers from looking at tobacco, and they keep redirecting our focus to e-cigarettes. So I think there needs to be a balance as well, so that we don't forget that we need to still continue to protect our people from cigarette use, because the industry has not stopped producing cigarettes. They still produce the cigarettes, and they still market them aggressively. And so we need to always balance these things as a continent. Thank you.
Merci beaucoup, Docteur Catherine O EGBE. Merci pour toutes ces explications. Et nous allons, avant de remonter les questions sûrement qui sont dans le chat, poser une ou deux questions à Docteur Lekan AYO-YUSSUF, au professeur Lekan AYO-YUSSUF, avant de remonter les questions dans le chat. Justement, professeur, quels sont les arguments pour et contre l'utilisation des cigarettes électroniques comme solution pour réduire les risques liés au tabac, et comment ces arguments s'appliquent-ils en Afrique subsaharienne? C'est vrai que dans votre intervention, vous l'avez abordé, mais nous voulons que vous reveniez encore là-dessus pour d'amples explications.
Thank you. Just to simply put, the only reason or the only argument that can be made for e-cigarette harm reduction is in situations in the rich countries where there's persistent high prevalence of use of tobacco products and high mortality despite full implementation of the FCTC provisions, including making available widely access to cessation support. In the African region, in Sub-Saharan African region, the situation is different. The argument against promoting e-cigarette from harm reduction is the fact that it may distract. Not it may, it is actually already distracting, and it will distract from implementing prevention policies in the FCTC that would reduce tobacco use and tobacco harms. These are all evidence-based, well-tested policies in the FCTC that has been summarized in EMPA. And it will also distract from the use of approved cessation aids. So in other words, in the continent where we do not have this effective implementation of the full FCTC, except for 2 countries, we would see harm reduction, promoting e-cigarette harm reduction as a distraction that has only to benefit tobacco industry, that wants to make sure that we do not implement the FCTC to the fullest. So my advice is that the African states should ensure they stay focused on full implementation of the FCTC, including making smoking cessation or tobacco use cessation accessible to the large population of smokers who need them. Thank you.
Merci beaucoup,
I cannot
professeur.
hear anybody anymore. Okay.
Merci beaucoup.
I can hear you now. Thanks.
Oui. Nous avons encore une question à vous poser, professeur, si vous le permettez. Vous avez observé des différences notables dans l'efficacité des cigarettes électroniques en tant qu'outil de réduction des risques parmi les groupes de population spécifiques, tels que les jeunes ou les personnes issues des milieux sociaux économiques défavorisés. C'est-à-dire, est-ce que vous avez observé donc des différences notables entre ces groupes-là, tels dans les milieux de jeunes, des jeunes, en tout cas des personnes ici des milieux socio-économiques défavorisés et des jeunes? Est-ce qu'il y a une différence notable dans l'efficacité des cigarettes électroniques?
Thank you for the question. Again, I think to clarify, I do not know of any country in Sub-Saharan Africa that has implemented e-cigarette for harm reduction. So there's no country that I know of that has specifically declared e-cigarette for harm reduction as a policy. However, industry is trying to convince many governments to do so. Coming back to your question, there is no role for e-cigarette for harm reduction in young people. Young people, the focus on young people is for them not to start smoking. It's prevention. So there's no need talking about harm reduction in children who are trying to experiment with cigarettes or not even using cigarette, and you're now talking about harm reduction. It doesn't make sense. There's nothing you are reducing. There's no harm you are reducing. You are only adding harmful substances to their body. So there's no role, talk less of effectiveness, for e-cigarettes being promoted for harm reduction to African youth, many of whom don't use any tobacco products, or what we call nicotine naive. Introducing them to e-cigarette is to actually sensitize their body receptors to nicotine. And when they want to take more efficient use of nicotine, they will graduate to smoking. For those from low socioeconomic background, cigarettes still remain the cheapest means of obtaining nicotine in the African continent. So there's the feasibility of e-cigarette working as a harm reduction for the population of those in the low income category is very slim, because they can obtain the nicotine in a much cheaper format, like roll your own cigarettes, smokeless tobacco, and the factory manufactures cigarettes. In fact, some other countries have seen that it can actually increase inequality in tobacco use. But again, just to make clear, e-cigarettes in the current format are more expensive than cigarettes in the African continent because many countries have not implemented Article 6, that is to make the excise price of cigarette at least 75% of that retail price. Given that situation, the low income are less likely to benefit from promoting e-cigarettes and harm reduction. So the youth, there's no role to promoting e-cigarette for harm reduction among youth in the African continent. And the feasibility of that being any effective intervention in low-income smokers is very slim, given how cheap cigarettes are in the African continent.
Merci beaucoup, professeur. Et il y a des questions, en tout cas, dans le chat. Il y a une question qui est posée par Alain Kambenda. Et la question s'adresse à Docteur Catherine O EGBE. Donc, nous allons lire la question. C'est en anglais, nous l'avons traduit. Monsieur Alain Kambenda voudrait savoir, bon, dit ceci, je lis. La question, justement, le principal défi dans la mise en œuvre de ces politiques en Afrique subsaharienne, quel pourrait être le principal défi dans la mise en œuvre de ces politiques en Afrique subsaharienne et notamment en Zambie, où nous attendons toujours que le gouvernement adopte le projet de loi? Quel conseil pourriez-vous donner à la Zambie? Je ne sais pas si vous avez entendu la question ou que je la relise.
Yeah, I got the question. I already answered it, but I can just say that we know that most of the delays is due to industry interference. The industry has a strong hold in many countries in Africa. But what I believe can happen is if civil society, if the people are not tired of pushing for the right policies, they will win at the end of the day, because they are fighting against a very strong opponent. They have the money, they have the connections, but then the people have the voice. And so if they continue to call out the government to do the right thing, I believe that at some point the government would listen to them. So my advice to Zambia, to any country in Africa, is to keep pushing, keep being active. Put your ears down, know what is happening in the space, monitor the industry's activities, and try to be a step ahead of them where you can, and keep speaking about the fact that these laws are important to keep the people safe and to keep them healthy.
Merci beaucoup, Docteur Catherine. Mais nous retournons au professeur Lekan pour remonter une question d'un participant, justement, Patrick Kakala. Il dit ceci, en termes de réduction de risques, quand certains pays de la CECLAT interdisent la consommation des e-cigarettes et d'autres n'interdisent pas, quelles sont vos recommandations à l'OMS?
The WHO already published a position which I support. So I do not need to make recommendations to WHO because the WHO has already made recommendations to member states. And I support that recommendation. And essentially, if you do not yet have e-cigarettes in your country in a substantial amount, the advice will be to ban e-cigarettes. Like I've just said, there's no role for youth, there's no role for low-income smokers. If you should rather focus on full implementation of the FCTC to make sure that you never get to the situation or the problem that is in these richer countries where you then need to introduce e-cigarette for harm reduction. So if you do not have e-cigarette in your countries right now, ban the entry of e-cigarette. If you already have e-cigarette to a substantial level and already been used, regulate e-cigarette in a way that you regulate your tobacco products. So your nicotine and tobacco products laws should be updated and future-proof to ensure that future innovations by industry, because they are not going to stop to distract you from regulating cigarette, would be covered by your current tobacco and nicotine laws. All you need to insert is that the law will cover all tobacco and nicotine products, except those that are governed by the Medicines Act or Medicine Control. So if e-cigarette, if they believe it's very effective, they can go into the Pharmacy or Medicine Act and follow the same process. Again, just to repeat, for countries that do not have e-cigarettes in their countries in a substantial manner, they should ban e-cigarette use. Countries that already have it should regulate strongly the way they would regulate cigarettes so that they don't get distracted running through two different legislations. They should use only one regulation and legislative framework. Thank you.
Merci infiniment, professeur. Merci infiniment pour toutes ces réponses. Le temps imparti s'étire, en tout cas, finalement, à la fin. Nous sommes pratiquement à la fin. C'était un grand plaisir, en tout cas, de suivre ce webinaire sur les thèmes cigarettes électroniques et réduction du risque, point de l'Afrique subsaharienne. Les deux éminents panélistes, finalement, hein, nous devons avoir 3 personnes dans le panel, mais finalement, nous avons les 2 éminentes personnalités dans le panel, Professeur Lekan AYO, Docteur Catherine, qui, vous les avez suivis et de long en large sont revenus justement sur cette problématique de risque, de réduction du risque. Quels sont les différents contours de cette problématique? Ils nous ont en tout cas suffisamment abreuvé sur cette question. Nous aurons dû continuer ce panel si le temps imparti n'arrive pas. Nous comptons qu'il y aura d'autres occasions pour approfondir le thème qui est très, en tout cas alléchant, parce qu'à voir les questions qui sont toujours dans le chat, on sait que les participants ont justement aimé les discussions. Mais pour les questions dans le chat, les autres questions qui ne sont pas remontées aux panélistes seront répondues souvent dans le chat. Mais quant à ce qui nous concerne ici, nous allons redonner la parole pour 1 minute à nos 2 éminentes personnalités, 1 minute chacun, pour que justement on puisse donner un mot de conclusion, un mot en guise de conclusion, parce qu'on ne peut pas quand même conclure cette thématique-là. Donc, si vous permettez, je donne la parole à Docteur Catherine O EGBE, justement pour un mot de conclusion pour ce webinaire.
Thank you very much. I think that one of the questions on the Q&A, I'll use that as my closing remark, by Alien Kabinda about the role of the media. I think, and this is for me, it's a very strong position that the media has a huge role to play in tobacco control in the continent. And I feel that we are not yet harnessing the power of the media enough in the continent. So for those who are in the media space here in this webinar, I think that you have a huge role to play. And if we could continue to work with you, and if you could continue to work with the civil society organizations in your country, there is a whole lot of achievement that we can get when we push the narrative for tobacco control in the media. because the media has the power to control the narratives in the country. And we know that a lot of the things that the politicians do now, or the policymakers do now, they listen to the temperature or the atmosphere, what is happening in the country and what people are talking about. So if the media continues to put tobacco control as a discussion in the public space, the government will be forced to take good action. Thank you very much.
Merci infiniment, Docteur Catherine. Je pense que les médias, en tout cas, qui sont des participants, ont pris bonne note de votre suggestion à leur endroit pour que la lutte anti-tabac regagne, en tout cas, en vivacité. Je m'en vais donc sans transition vers Professeur Lekan, justement, pour avoir son mot de conclusion sur ce.
Thank you. So I think the message should be clear, taken from what Dr. Catherine said. The message should be clear to policymakers and the media. This e-cigarette issue is not, in fact, not just e-cigarette, you also have things like oral nicotine pouches. These are not harm reduction. It is all about industry normalization. It's a harm reduction for industry profit. This is what they are promoting. They are not promoting harm reduction for disease and tobacco use. It's harm reduction for profit of industry and industry normalization. That is the message I would like both the policymakers and media to understand. Because once they start to say they are now good guys, they want to reduce the risk of harm or the risk of their tobacco product. Why don't they stop making those tobacco products and then only make e-cigarette? The day they tell us they have closed their factories that make cigarettes, we would begin to believe them. But they are still promoting cigarettes in African countries. So it is clear that all of this is to make sure they do not get harmed by their profit. So it's not harm reduction for disease and use of tobacco, it is harm reduction for profit and industry to normalize themselves, because now they're able to talk to government because they're talking harm reduction, because they cannot talk to government before about tobacco use or cigarette smoking. Now they want to talk to government about harm reduction. So media, policymakers, be aware, this is not harm reduction. It does not work in Sub-Saharan Africa, and we should be against this distraction. Thank you very much.
Merci infiniment, professeur. En tout cas, professeur Lekan est clair, la cigarette électronique ne contribue pas à la réduction du risque. En tout cas, c'est un langage des firmes pharmaceutiques pour bluffer peut-être en quelque sorte l'opinion. En tout cas, ça ne vient plus, le terme n'est pas employé comme cela par le professeur, mais avoir de clair cette stratégie des instituts de tabac d'évoluer dans la sémantique en employant justement le mot de réduction de risque en abordant la cigarette électronique est une façon de sournoise quand même d'introduire toujours la cigarette en faisant croire qu'on veut améliorer des choses, mais c'est la recherche du gain, du profit qui continue toujours. Merci infiniment, professeur Lekan, pour toutes ces explications. Merci à Docteur Catherine O EGBE pour le partage sur la problématique. Merci aux participants. Merci à Tika qui nous a donné l'occasion à la Journée mondiale de la jeunesse pour justement avoir ce webinaire sur le thème cigarettes électroniques et réduction du risque, point de vue de l'Afrique subsaharienne. Et je pense que la jeunesse, en tout cas, que les films du tabac veulent cibler, justement, on cible tout le monde, mais on voudrait embarquer en plus la jeunesse en essayant de faire ce changement de conception pour que les jeunes soient de plus en plus emballés. Ces jeunes-là, à cette journée de la jeunesse, avec ce webinaire, je pense qu'avec le relais aussi peut-être des médias, ces jeunes-là seront véritablement sensibiliser sur la question pour le bien de l'Afrique subsaharienne et puis pour le bien de nos jeunesses. En tout cas, ce n'est que partie remise. Nous espérons nous retrouver sitôt pour un autre webinaire. Merci Atka, merci aux participants, merci à nos éminents panélistes et à très bientôt. Je vous remercie.